First, why the days of seeing your GP for free are numbered. Medical practices that for years have bulk billed are now being forced to charge patients. Doctors say it's a case of either pay up or they'll be forced to close their doors.
We know our health system has been swamped to the point of near collapse.
It's under a huge amount of pressure and it's only going to get worse.
Hospitals are full, ambulances are ramping, wait times are exploding, doctors and nurses at breaking point.
If the Medicare rebate doesn't pay for it, somebody else has to.
And now we're being warned our GPs are flatlining.
Well, medical practices are going broke and in fact we're seeing a massive number of practices just shutting their doors.
More and more patients are finding it difficult to see a GP who is bulk billing.
Leaving pensioners like Graham on Queensland's Sunshine Coast with trouble.
Well, finding a doctor first and then finding a doctor that bulk bills, yes.
As more and more doctors charge a gap fee on top of the standard $39 Medicare rebate.
Medicare this year went up a paltry 60 cents per consultation. My face mask costs more than 60 cents and I've got to change that 5 times a day at a minimum.
Jeff Taylor's a GP in country South Australia.
You know, costs are going up. My insurance went up 18%. If I don't have insurance, I can't practice medicine. Then you've got work cover, you've got rates, you've got all of your supplies.
Last month, his practice ditched bulk billing, introducing a gap of between $20 and $40.
It was a really difficult decision. People who are bulk billed are generally pensioners or those people who are struggling. They've got complex medical issues and they do require frequent attendance at the clinic.
It's a familiar story around the country, says head of the Royal Australian College of GPs, Karen Price.
We know from our own survey that at least 50%, if not more, GPs are saying their practices are becoming unsustainable.
The doctor I go to last fortnight decided not to bulk bill anymore. $82 to go to the doctors.
And that has people thinking.
It's a matter of get your veggies or go to the doctors. And where I am is all older people, and some have said they can't go to the doctor, they can't afford it.
And that's the rub. As more GPs choose to abandon bulk billing, more patients choose to put off seeing a doctor until they're so sick they end up at a hospital emergency department. And hospitals are under enough stress as it is. Doctors say the system is on life support and needs urgent, radical surgery, starting with the basics.
We know that we prevent people going into hospital. We know we keep them out of hospital for much longer, and we know we can manage most of the health conditions in the community. So it seems crazy that we've had a freeze on one of the most deficient parts of the health system.
In Sydney, the Redfern Station Medical Clinic has been forced to charge a gap.
We have seen an incremental reduction in our incomes and the ability for the practice here now to continue to really well fund the nurses and reception staff and that sort of thing. So this year the practice introduced gap fees for everybody.
Dr Mari Healy says the Redfern Clinic has become a mixed fee clinic where those who can afford it pay the gap while those most in need don't.
I'm sort of towards the end of my career and I'm used to sacrificing my sort of free time and personal time to provide good continuity of care. Like I'm an old-fashioned GP that still provides home visits, but I wouldn't probably like to be in this job if I was coming into medicine if the fee structure stays the way it is.
Dr Healy worries we could see a shortage of GPs unless something changes. She wants better Medicare funding.
And if that Medicare rebate doesn't really cover the time and the effort and the skill that we're providing, the money has to come from elsewhere.
Marlene's Dr Healy's patient.
If you have to pay, you have to pay. You know, you can't get everything for nothing. I understand that.
Karen Price wants Medicare to return to how it was when established in 1984.
It was never meant to cover the entire cost. We really need to look at what Medicare was intended to do, and we need to get back to that understanding that it may be beneficial for the whole country for some people to pay a small gap and others to be subsidised fully.
Or face the real costs.
We used to have 12 doctors, we're down to 6. What I worry about is that over the next 10 years, I'm going to have nobody to replace me, and we're just going to walk out and shut the door, and towns will be left without medical care.
Medicare is the patient's insurance. We're actually fighting for patients' rights to have the Medicare that they deserve.
And if you are in genuine financial hardship, you're advised to talk to your doctor about being bulk billed.